long-term 3-year project. So again, thank you for joining us for this webinar in the series. And just a quick note that we do have upcoming webinars May 10th, May 17th, and May 31st. So check that out, and we definitely invite you to register for those upcoming webinars. And one more thing, as we go through this webinar and as you think about it, and if you have time, we certainly would love your feedback. I'm going to post that in the chat there. If you get some time and think about other things that you'd like to hear about, or maybe other individuals that you'd like to hear about, in addition to the great lineup that we've provided and are providing, just feel free to include that in that survey. All right.
All right. All right. So thank you again for joining us today. We are going to ask if you'll please mute your speakers while, mute your microphones while our speaker is presenting. If you have any immediate questions, feel free to put them in the Q&A chat. And then at the end of our session, we are going to go ahead, we'll stop recording and we will open the cameras up to you. Feel free to turn on your microphone, turn on your video, and ask any questions that you've been holding on to for our presenter. We'll also have a few QR codes throughout the presentation linking you to some of the DHHS websites. So if you would like to have your phones ready, you can scan those. But without waiting too much longer, I am very happy to be able to present our speaker today. Cheryl Slachta is an environmental health regional specialist for the Food Protection and Facilities branch of North Carolina. She's one of 2 team leaders who together, alongside a field supervisor, lead a field staff of 8 regional specialists across the state. The entire regional team provides training, interpretation, support, and delegation of authority to environmental health specialists in all local health departments. They also provide support and interpretation to help bridge the gap between local health department staff and the industry. So I'm going to go ahead, I'm going to stop sharing, and I'm going to pass the torch over to Cheryl. Thank you for being with us today.
Thank you for having me, Kate and Lynette. I appreciate it so much. Yes, I am going to begin sharing without further ado. Thank you for that introduction. And gotta figure out which screen I am sharing. I think I've got the right one. Yes. All right.
Perfect.
Before I get started, I just want to make sure, are you guys seeing the panel on the side?
Yes, it looks
all right, I'm moving it.
No, well, we can only see your presentation. It looks perfect.
Oh, you couldn't see the panel. Okay. All right, awesome. It was showing weird. I'll put it back. Okay, so if you guys aren't seeing what I'm seeing on the right, I'm going to go for it. So again, I'm Cheryl Slachta. I'm one of the regional specialists for the Food Protection and Facilities branch. We are part of the Division of Public Health under the Department of Health and Human Services. It's a mouthful. So it's easier just to say we are the Food Protection and Facilities branch. I'm going to actually turn my camera off as well while I do this presentation so I'm not distracting you all. So, okie doke. So the things we're going to cover today, we're going to start with regulation, and there's a lot to our regulatory foundation that includes laws, rules, and our food code. I'm going to also touch on some permitting items that are like hot topics, I think, for this audience. Also, some things that are kind of on the horizon, if you will, and also kind of define a little bit more about our jurisdiction, meaning how DHHS, or the food program, works alongside the Department of Agriculture, who you have heard from in previous seminars. And the first part I want to start with is, of course, our regulation. And these cards should be extremely familiar to everyone, no matter what type of industry you are in or what branch of government you may be in. Everyone recognizes these cards. And these are kind of the face of our program. What the Food Protection and Facilities branch does is we regulate food service establishments. We also regulate lodging and bed and breakfast. I just use the little acronym B&B there, but bed and breakfast homes and inns, not Airbnbs, by the way. We also regulate institutions. Those could include hospitals, nursing homes, those sorts of places. Camps. We have different types of camps that are defined and regulated by our program, which would include resident camps, summer camps. The summer camps just went an overhaul of their rules, and those are going to be presented actually very soon to our local environmental health specialists. And also primitive camps. Those are under our authority as well. Adult day services. That's one that a lot of people may not realize is under us. We do the sanitation inspections for those as well, and local confinement. Also residential care homes, and residential care homes also went through a rule revision process recently, along with the summer camps. This is a very helpful tool for people to find out who to contact. So we have a very colorful map here of North Carolina that shows the counties that each of our regional specialists help to provide that guidance, that interpretation. Also, we do, when I said delegation of authority, or Kate did actually, delegation of authority is that we give the county staff the authority to perform the routine inspections, to do the permitting of certain facilities under our regulation. So we give them that authority. We grant them that authority. That is a big, huge part of our job. And again, you can see we cover all 100 counties, and we have a pretty large team. So I wanted to break down to begin with, what are our rules? So our food establishment rules are what we call the 2600 rules. And we are given the authority to adopt rules under General Statute 130A 248. That is what gives us the regulation, the authority to regulate food and lodging establishments in North Carolina. So then that leads into the 2600 rules. These rules are the specific regulations for food establishments in North Carolina. This is the main document upon which regulation of food establishments is enforced. This document contains requirements for inspections and re-inspections, mobile food units and push carts, temporary food establishments and temporary food establishment commissaries, limited food service establishments, and other items as well. We also have permit action, enforcement, and appeals rights that are also governed by this set of rules. And then what happens under the food code is we utilize under the rules, we utilize the North Carolina Food Code as it is incorporated into our 2600 rules, and it's used as our document or our guidance tool to regulate our food establishments here in North Carolina. The food code, however, cannot stand on its own. It has to be used to support the 2600 rules. And another important piece is newer versions of the FDA food code cannot be adopted until it's allowed by the North Carolina General Assembly. So the rule in 2600 that gives us all this authority to even utilize the food code is our Rule 2650, adoption by reference. What this does is it incorporates currently the 2017 food code and the supplement by reference. When this presentation was last done, I believe in 2021, we were still under an older version of the food code, actually the 2009 version. So we are now with a much more current version of the food code. But as I said a moment ago, we can't just automatically adopt each newer or subsequent version of the food code. We do not have that authority granted to us by the General Assembly. Again, back to that familiarity that you all likely have with us, is seeing those grade cards. And I wanted to just go over a little bit about grade cards and the rule that clarifies everything about those. So they have to be where they can easily be seen by the public. They are also placed in a location chosen by the environmental health specialist, or REHS, as you see there on the screen, unless an alternative location is agreed upon with the person in charge at the establishment. We always remind our inspectors that the grade card is really ours. Does not belong to the restaurant. It belongs to us. So it always needs to be placed where it's readily visible upon entering. It shouldn't be something you have to look for when you walk into an establishment. And also, they have to be in that designated location at all times. They can't be removed. They cannot be hidden. We've had situations where a restaurant didn't like their grade, so they put a tree in front of it. So we can't do things like that. The grade card has to be visible. And this is coming from rules, so this is very important. Another piece, it needs to be where the public purchases food on a mobile food unit or a push cart. So this came into effect, I believe, with our newer rules back in 2021. So the posting of the grade card on those units it has to be visible. So if you're not seeing one on a mobile food unit or a push cart, you need to ask because it may not be regulated. So you want to know. And going back to those grades, I just want to give you the range. It's kind of like being in school. At least a 90% score will warrant a grade A. Anything between 80 and less than 90 is a B, and anything between 70 and less than 80 would be a C. And an interesting fact, if you didn't know, if a score falls below a 70, the permit is immediately revoked. That means they have no more permit. They must shut their doors and they must come up to compliance before they can open their doors again. So I wanted to talk a little here about our food code because this has changed. We got our newer version, our 2017 version, in October of 2021. This really helped us quite a bit. It did clarify some things that maybe were not as industry friendly in the previous version of the food code. And I'll go over some of those things that were clarified. And it also gave us some more current science in this version of the food code. All right. And oh, one thing I do want to also point out, sorry, is we don't necessarily adopt every piece of the FDA food code. Some codes are removed, some we add our own language, or some we change to meet to North Carolina specific requirements, things that are not in the food code. Some of our special provisions, such as our I don't know, congregate nutrition sites. I wanted to come up with the correct term. Congregate nutrition sites are not something that would be automatically understood out of the FDA food code. So we have special provisions in our rules for that. The food code is based on a couple of things. It's based on foodborne illness risk factors. And I just wanted to highlight those. Improper practices or procedures that are most frequently identified in outbreaks is really what gives us these foodborne illness risk factors. And the FDA and the CDC, along with them, they have determined that these 5 items are the biggest risk to foodborne illness or injury at the retail level. The first one is improper holding temperatures, and that includes hot and cold holding, inadequate cooking of raw animal foods in particular, contaminated equipment, so equipment that is not cleaned and sanitized and handled properly. Unsafe sources is a huge risk to our food safety. And of course, people, so poor personal hygiene, which includes not just hand washing, it includes employee health, it includes just all of those things, no bare hand contact with foods, things of that nature. The food code also talks about interventions, and these are simply preventative measures that are identified in the food code to protect consumer health. So each of these management's demonstration of knowledge, there is a requirement that managers or persons in charge must pass a certification exam answering questions about risk factors and active managerial control. Employee health policy, I briefly mentioned that just a moment ago. An employee health policy that can consist of when and how employees are to notify their management if they are possibly down with some sort of illness, or they have some sort of symptoms, or even if they're a caregiver or have someone in their home who is experiencing illness or symptoms as well. Controlling hands as a vehicle of contamination is huge. And, simply put, it could mean gloves are used when hands need to be used to handle food. It could mean utensils, deli paper, tongs, different things. The bottom line is we do not allow any bare hand contact with ready-to-eat foods. And that means ready-to-eat foods that are not going to go through a kill step or a cooking process to eliminate pathogens of concern. And then time and temperature parameters, that would be like hot and cold holding, proper cooling, proper thawing, proper reheating. All of those things are part of that intervention of time and temperature. And then consumer advisory. So this includes notices on menus or table tents, placards. You may have seen shellfish signage, things that are warning the consumer that something may or may not be safe to eat. An example, I mentioned the shellfish signage. If you've ever been to a seafood establishment that serves oysters, you likely have seen the oyster consumer advisory or the shellfish consumer advisory that basically warns you and reminds you that foods that are not cooked to kill off pathogens may make you sick or even worse. Okay, so that's what consumer advisory is. And those are the food code interventions. This is just showing you the food code is a large document in itself, but it also includes an annex. And this annex provides all kinds of supporting information. It provides public health reasons for why things are required in the food code. It's really super helpful when trying to interpret the food code. And we use this document quite a bit in our daily regulation affairs. And it provides scientific data that also supports the provisions. It's laid out in this manner. So the first part talks about compliance and enforcement. And of course, we have state and local statutes, regulations, and ordinances in North Carolina. And so that's going to vary a bit from state to state. And the North Carolina Food Code, as I said, is not an exact copy of the FDA Food Code. We do have our own specific requirements and enforcement strategies that may be different than the FDA Food Code. Annex 2 provides reference material and scientific research that supports the code. Annex 3 is where you find public health reasons. This is the one that we probably use most frequently to understand a citation or to understand why something falls under a certain citation in the food code. There are also flowcharts on when to exclude or to restrict sick employees. And there's an explanation on why 41 degrees as a cold holding temperature is important in the reduction in the cases from listeria. So North Carolina was at 45-degree cold holding for a very, very long time. And we finally got 41. Gosh, I should know the date now, but it's fairly new still kind of in North Carolina compared to how long we had 45, but 41 is much safer. Annex 4, achieving active managerial control of foodborne illness risk factors. This is very important because the safety really lies in the management of the establishment. HACCP principles are discussed, and charts showing types of different hazards, biological, chemical, and physical, are all included in Annex 4 as well. Annex 5 is all about conducting risk-based inspections. And we recommend that we require that all new environmental health specialists in the state read this chapter. It discusses risk frequency, proper equipment that needs to be used during an inspection, the timing of inspections, and how to actually physically walk through and conduct a proper risk-based inspection. Annex 6 is food processing criteria. This really, for us, goes hand in hand with our variance requirements. So special processes, any type of reduced oxygen packaging, or any type of fermentation of meats or things like that actually are really elaborated on in Annex 6. And then Annex 7 includes the model forms, guides, and other aids. So this is where the model inspection form lives. And then in North Carolina, we made it our own, and we tweaked that to fit our needs. And we added points because the FDA food code model form does not include a point system. It's just in or out. Right. Wanted to also go over some changes that we adopted along with the 2017 food code back in 2021. One of those things was changing the definition of a potentially hazardous food to what we now call a TCS food. And TCS stands for Time Temperature Control for Safety Food. This is now throughout the food code, and you don't even see the word potentially hazardous food anymore in our food code. And these are, in short terms, these are foods that require cold holding or hot holding during storage and display for safety reasons, not just for quality. Another change that took place in 2021 was the requirement that the person in charge at a restaurant shall be a certified food protection manager. And they become this by taking an exam and passing that exam. And that exam is part of an accredited program. So we just have a couple of examples there that you may see along the same place where you normally see the grade placard posted. Reportable diagnosis, this actually changed and changed in the 2021 food code. There was an addition. We used to have 5 reportable illnesses: norovirus, hepatitis A virus, Shigella, E. coli, the Shiga toxin producing E. coli, and Salmonella typhi. And the 2017 food code, or it might have been the 2013, my memory is not serving me well today, I apologize. But after the 2009 food code, I'll say, Salmonella, the non-typhoidal Salmonella, was added to one of this list of reportable diagnoses. So we now have 6 diseases, pathogens of concern that we are looking for knowledge on this. And we also are making sure that they have trained their employees and they have revised employee health policies for their employees, for their food handlers. The addition of a cleanup of vomiting and diarrhea event, this also came into play for us, and it requires written procedures. North Carolina provided a 4-page template to assist the operator in developing their procedures. We also developed this placard poster, if you will, that pretty much encompasses what the procedures are requiring an establishment to do and to have in place. And this is an addition to that. And we mostly see this in our establishments when we are doing our inspection. These are usually posted in their kitchen facilities. This is super important because this is minimizing the spread of contamination, and it could be any contamination, but it's typically because of norovirus. Norovirus is so easily spread and so virulent that if someone has norovirus and has an incident in an establishment, it's very, very difficult not to spread it to people. We just actually are investigating an outbreak this week and similar situation where someone did have some sort of vomiting diarrhea incident in the bathroom, and now there are sick people coming from that establishment. So even though they have these in place and they attempted to do the right thing, it's very, very difficult. But these procedures are meant to minimize the spread of contamination to surfaces and food in the facility and to limit the exposure to employees. It specifies who and how things should be cleaned, and that was a very, very significant addition to our food code in 2021. Another important addition that we were able to take on was operating during an emergency. So we did not have this prior to our 2021 adoption of our food code. And we did have a couple of places, larger chains, grocery stores in particular, they want to keep operating when there's an emergency because they want to serve the public and they want to help people have access to food and water. And so this is really important, and it's a great addition to our food code and to our rules. But this is basically stating that they have to have a plan in order to do this. And there are, all kinds of health hazards that could cause extended interruptions either to electric or to water service. And, continuing the operation of some of these establishments during emergencies, it may be cumbersome, to us who are in the regulatory arena, but it's so crucial for the community, and the facilities are very, very passionate about remaining open and providing what they need to their community. So it's really great that this has been added in to our regulation so that they can continue to operate safely and with a plan, and that we know about it. Some newer regulation changes that have come into play since anyone last spoke to this group are a couple of session laws. And this session law in particular, this was just last year, it changed our risk category 4 establishments to once every 4-month period. I don't like the way that's worded, but that's what it is. Really, instead of it being quarterly, so once in a 3-month period, now inspections take place once in a 4-month period with the addition of an educational visit during the fiscal year. This is only for our category 4 establishments. Category 4 establishments are based on, risk. They're based on risk, and they are your more, I guess, involved facilities. They have more procedures. They probably are doing a lot of cooking and cooling, maybe some reheating. So they are doing more extended processes in their establishments. And then any establishment that does utilize like a specialized process or has any type of variance to deviate from the code, those are also considered category 4s. So what it does essentially is it gives them 3 regulatory inspections in a year, in a fiscal year, with the addition of an educational visit. And that educational visit is a little interesting because it wasn't super clear. Oh, sorry. It wasn't super clear in this designation about how these would take place and what they would involve, but it does give information that they are not to be an inspection, they are not to receive a grade, and they are to be based on 3 previous inspections, and only the risk factors, the public health risk factors. So what that is deemed as are priority violations that are in our food code. So if they have any of those, that's what the educational visit is based on. And if they are like a new facility that hasn't had 3 inspections, or if they do a phenomenal job and they haven't had risk factor, public health risk factor violations in their 3 previous inspections, then our specialists can conduct like an in-service or just a training on any type of foodborne illness risk factor. Another change that took place in session law last year was for bars. So there was a lot that happened here and it's still happening. So I just wanted to bring that up. But there are some exemptions now for bars, and that came through the ABC laws, the ABC Commission. What has happened, beverages that have food as a garnish are exempt. So there are lots of places that are getting creative. I'm going to talk a little bit more in just a moment about what's on the horizon. We've seen cheeseburgers as a garnish on a beverage, but if it's considered a garnish, then really it's exempt currently. If they are not preparing or serving food for pay, they are exempt. Bars that are serving non-TCS food for pay, according to the definition in the food code, they would be exempt. Also, bars that could be defined as private using a tax exempt status or private by the ABC Commission under their regulatory authority would also be exempt. So this has happened. There have been quite a few repercussions from this, and it is a hot topic back in the general session as we are speaking right now. So I'm going to move on to permitting. There are some concerns with permitting when we talk about permitting our normal food establishments, our restaurants, our food stands. It's not super complicated, but where things get a little bit tricky and questionable is when we get into our temporary food establishments and even temporary food establishment commissaries and what happens with these. So you've seen these, we all see these. We see them at festivals and carnivals. We see them just on the side of the road or in the parking lot of your favorite shopping complex. So these kind of pop-up mobile food units, temporary food events, you just never know where you're going to see something like this. This particular picture is more like a mobile unit, mobile food unit, but temporary food establishments, also agritourism. I know there are some folks probably on this call that are part of that, and markets, farmers markets. So these types of settings could warrant needing a temporary food establishment permit. So I'll try to explain who is eligible and what it kind of means. If they prepare or serve food, they operate for a period of time not to exceed 30 days in one location. If they are affiliated with and endorsed by a transitory fair, a carnival, a circus, a festival, a public exhibition, or agritourism business. And for purposes, I just want to explain for purposes of the agritourism subdivision, that is covered in General Statute 153A 340B 2A. But anyway, that is also part of what could warrant a temporary food establishment permit. There also is now the eligibility to extend the permitting to for up to 15 days one time. That's written into our rule as well. So there are some things that, if an event is going to last longer than 30 days, and those days don't have to be consecutive, by the way. So it's really given us permission to permit something that may take place for 45 days. And this works out well for summer type things, markets and festivals that are set up on weekends, possibly. And that is something that sometimes can require a TFE permit. We call it TFE. Then our push carts and mobile food units, just wanted to kind of discuss the definitions of those. A mobile food unit is a food establishment on wheels, pretty much, that is designed to be readily moved and vend food. That is what is defined as. A push cart is a mobile piece of equipment or vehicle used to vend food. So they're very similar by definition, and those are defined in our 2600 rules. Neither can provide seating for customer use. They must be permitted by the regulatory authority that inspects the commissary from which a push cart or mobile food unit is to operate. And this gets really sticky and complicated because there are mobile food units that may have a commissary in one location or county, and they may operate in another. And that does cause some friction sometimes when it comes to trying to regulate those facilities. So we try to go with the fact that if they are using a commissary in a certain location, they should be permitted out of that location and county. That's the best way to do it. Of course, there is a caveat. There is an option for mobile food unit to be permitted as its own commissary, and that is not easily handled. It takes a lot to make that happen. It's a lot of legwork to make sure things are in place for that individual because they don't have a facility to go to store their food and store their supplies and to really prepare anything. So it can happen. There are not as many of the mobile food unit with their own or as their own commissary, pardon, as there are mobile food units that use a commissary in the state, but there are some out there. Just want to make sure I'm looking at my notes to make sure I don't miss anything. One of the things that they have to do is they are to keep a list of their locations of where they will operate so that they can be found to be regulated and to be inspected. Push carts are a little different. Push carts are only allowed to serve hot dogs and condiments for those hot dogs. They can also serve pre-wrapped foods on those that were wrapped in a regulated commissary. So that can happen. But a mobile food unit can pretty much be like a restaurant on wheels and do just about anything that they can in that space that is allowed by their regulatory authority. Just want to make sure I covered everything there. Now, some things that are on the horizon. There are all kinds of things that are happening, and I don't know if any of you know what this is, but that is a Mexican corn dessert that has appeared, and many of you may already know about this, but it has hit some areas that didn't know exactly how to handle this type of situation. The bottom line is we consider this TCS, and it does require our regulation, and that's going to kind of draw me into our jurisdiction along with NCDA before I wrap up. There are, TCS and non-TCS beverages that are popping up on the horizon. Kombucha, there's bubble tea, there's all kinds of drinks that really are not TCS, something that we would be overly concerned about the food safety, but that are being served. If they're being served in single service, then our partners over at NCDA are happy to handle those. And if they are using multi-service utensils, that kind of throws it back into our wheelhouse. There's all kinds of fruit concoctions out there. There are smoothie bowls. There are smoothie drinks, acai bowls. There's all kinds of things that are, people are getting very, very industrious. I love to say their entrepreneurial spirit is high, and we appreciate that. It's just they're getting ahead of us sometimes. So also meal prep. That's one of the things, virtual branding. I'll show you a slide on that in just a second. We kind of go with, is it retail or is it wholesale? So there's all sorts of caveats to try to determine who regulates you. And then the shared use kitchens. I was happy to see some of my friends from that group on this call today. And, there's lots of things happening in shared use kitchens that may be regulated by the food program, by DHHS, or may be under the Department of Ag's jurisdiction. So there are all kinds of things that are cropping up literally, and we are trying to stay on top and figure out where, where the regulation is going to live. And I just use this slide because we shared this a couple of years ago, but virtual branding is such a real thing. And what it is basically an operation within an operation. And it doesn't really require an additional permit. But it is worth noting on an establishment's permit that they are using a different brand to talk about their food, to sell their foods. And this example, if you go online, you may find Cosmic Wings, and it's really coming out of Applebee's. So that's just an example. It's not always obvious. And when our inspectors are out there in the field, they have to ask those types of questions and determine if they are doing some virtual branding. And this is like your foods that are picked up by Grubhub or something, possibly. It's that sort of thing where it's just like a different name, but it's coming out of a already permitted kitchen. So we took away the term ghost kitchen. We ended up going into more virtual branding when we talk about this. So it's really interesting. And I don't know if any of y'all have ever seen this, but be on the lookout and kind of know where your food is coming from. So I'm going to get into a little bit here before I wrap up about our jurisdiction. We work very, very closely with the Department of Agriculture's folks with Food and Drug, and also Meat and Poultry. And we communicate quite frequently and try to determine who's regulating what, right? And we recently met this week, and this is just a latest screenshot of kind of how we break down what is out there and who should be regulating it. So you can just kind of see this is it's a page that we use in the environmental health realm, but also our NCDA partners use this as well to help understand where the jurisdiction lives. I'll just zoom in a little bit so you can see it a bit better. But there are things out there, like I said, people are getting really creative. Fried butter, yes, that's on the list. So fried butter and candies, pancakes and waffles, it just depends on what they're going to do, what the end product is going to be, and whose regulation it's going to fall under. So it's very interesting how we do that. We're not the only agency, of course, in North Carolina responsible for food protection and food safety. We partner with the Department of Ag, and it can be sometimes difficult to determine who regulates what. There's a lot of gray area. And if ever you're questioning, your local health inspector, your local environmental health specialist can help, determine who you need to talk to. If it's not them, they can help figure that out. Our regional staff, as I showed you on the very beginning of this presentation, we have a very large group of regionals who can help with all of this, and just determine who does what in this regulatory realm. And then we will get that. We haven't posted it yet to our website, but it will be coming up very, very soon. And just in summary, I just wanted to reiterate, our regulation, it's comprised of laws and rules and food code and guidance documents. I didn't mention position statements. We have all kinds of things. The permitting just can really extend well beyond a typical restaurant or food service establishment, with our temporary food events, our mobile food units, our shared kitchens, and all those things. And then just keep in mind, there's so many things that are popping up and on the horizon, and food is evolving, and the way people prepare food and disperse food out is really, really evolving and changing, and has for many years. And then just again, that figuring out that jurisdiction, whether it's your health department friends or whether it is your Department of Agriculture friends. And so with that, that is all I have for this presentation. And there is my contact information if you'd like to grab that. Of course, it will be on that link, I'm sure, that Kate provided as well.
Thank you, Cheryl. I'm going to go ahead. I'm going to pause. With that being said, I'd like to once again thank you so much, Cheryl, for being with us today. Lynette, if you wouldn't mind posting that survey in the chat. If you have any additional questions, go ahead, leave them in that survey. We'll get them answered, and we'll be able to follow up with our recorded posts that'll be posted on our website. I will send that link out to all of our registrants once we get that processed and posted. So you can go back and rewatch any of this or utilize it as a resource. And then again, on the right-hand side of the screen, we do have 3 more webinars left in our spring series. Next week, we're going to be joined by the North Carolina Department of Agriculture, their meat and poultry inspection service. And then on May 17th, we're going to have a fine print webinar kind of going through exemptions, registrations, and licenses from the farm through processing into retail establishments. And we'll be wrapping up our spring series on May 31st with an in-depth look at food labeling and allergens. So feel free to scan that QR code, register for anything that piques your interest, and we look forward to seeing you then. But thank you again so much for your time today, Cheryl. It was great
Thanks,
to hear
Cheryl.
from you.
I want to go find that drink that has a cheeseburger as a garnish. So you piqued my interest there, right?
Very interesting. Thank you all. Appreciate you.
Thank you. Have a nice day.
Thank you for joining us. Great information, Cheryl.